begin. So I'll just do a little intro. Welcome everybody, whether you're watching the replay or whatnot. Welcome to the second episode of What the Health, and just a little tribute to friends. This is the one about mental health. So all the questions tonight that I'm going to be asking our guest expert, Dr. Ivy Branin, a naturopathic doctor based in New York City, but really she's worldwide, to be quite honest. And she is going to really get us to see what the difference is when you look at mental health from a physiological perspective. And when you take out like the psychological foundation of what we might know about mental health, specifically depression and anxiety, and also break some of the myths that we think and we believe are so strongly bonded to why we think we experience depression and anxiety. A lot is revealed, and we learn so much, and we realize we actually don't know so much still about the brain. So if wherever you're watching, I just want you to write in the chat, or you can even just think about this question if you're watching the replay. What do you think of when you hear the term mental health versus brain health? Mental health versus brain health. And if you're live, yeah, you can just type it on in the chat. Like, what comes to mind? You think mental health, what appears? And if you were to use the term brain health, is it different? And as you're writing that, I'm going to have Dr. Ivy just introduce herself again to any new faces listening tonight.
Thanks so much, Christine. Hi, my name is Dr. Ivy Branin. I'm a naturopathic doctor, mostly based in New York City, but now that we live in like a wall-less, it's like we live in both like a very walled and very wall-less world because everything is virtual. I have patients all over, so not just in the New York City metro area. And if you've never heard of naturopathic medicine, you're not alone. A lot of people have never heard of it. And one of the ways that I like to talk about naturopathic medicine is that it's a patient-specific system of medicine, meaning it's very specific to the individual patient. It's not a one-size-fits-all approach. And we are really looking for the cause of what is going on with the patient to treat and manage the conditions that the patient is experiencing. So rather than just mass symptoms. And just like one little brief thing about naturopathic medicine is that we have 6 governing principles. First being, first do no harm, which is very similar to what most medical doctors practice, but we also believe in doctor as teacher. So tonight, hopefully you'll learn something as I'm doctor as teacher, preventative medicine. So really looking at what are some things that could be potentially causing conditions around, like down the road, and what we can do to change beforehand, looking at the whole patient. So it's not just what's going on physiological, but what's going on in the environment, what is going on emotionally, mental, what are relationships like. So really looking at all facets of the person, looking again like root cause, very important part of our principles. And the healing power of nature, which is so important. So we really look at, we have this concept that, our bodies are intelligent, that even when we're displaying symptoms that are annoying and burdensome, that there actually is some intelligence behind it. And it's actually giving us a lot of information on what we can be doing to help the patients. And then the other big part is also what we, I think it might be one of our principles, or it could be something, but looking at obstacles to cure. So looking, what are the things that the patient is doing? What are the things standing in the way of optimal health for the patient?
I love that. Thanks for taking us through those really clear up where you're coming from a naturopathic perspective. And I love what you said about the body's natural intelligence. I say often, the body's sending us messages all the time, even if they're burdensome or really awful. symptoms or like how we're feeling. But like anxiety and depression, from my own personal experience, I look back and I think, wow, they were such messages. The body was trying to tell me something, and I really needed to just open my mind up to listen, and to ask different questions. So let's actually take that and go right into our first question, which is, since naturopathic medicine looks at symptoms and asks what is the root cause, how does like how you practice look at depression and anxiety?
Oh, wow. So it's a lot of things. So obviously, like in my case taking, I'm looking at a lot of other factors. So, when it comes to mood disorders, I mean, specifically because I think a lot of the people perhaps today on this call are women. So one of the things we definitely want to look at is female hormones, and specifically how do these how does the mood disorder play as a part of the cycle, and does the cycle make these symptoms worse? Because definitely the estrogen and progesterone, yes, they're hormones, but they do act like neurotransmitters in the body. Plus, they also have an effect on our neurotransmitters. So that's definitely one of the factors that I'm always going to be looking at.
Yeah,
Also,
real quick, when you say those hormones act as neurotransmitters in the body, what do you mean by that? Are they directly impacting our brain neurotransmitters? Or
so both actually. So estrogen is what we has what we call excitatory properties. So you have maybe I should should I do like a little like background on like
do it.
neurotransmitters, uppers
Yeah,
and downers.
do it.
So you have neurotransmitters that make us more hyped up, which sometimes can be good, but sometimes like when we think about like if we want to sleep, not so great. So that's dopamine, norepinephrine, and epinephrine, which norepinephrine and epinephrine are what we consider like adrenal neurotransmitters, which come from the adrenal glands or
Like
adrenaline.
adrenaline.
Right. And then besides though, and then serotonin is maybe I should even save serotonin for later, but serotonin is a neurotransmitter that can both have excitatory and inhibitory. So inhibitory meaning more down type properties. Now, not neurotransmitters, but hormones that have an effect on mood in more of an up-like way would be estrogen. And this is one of the reasons why sometimes for some women, specifically around ovulation, which is where estrogen is the highest, might notice that they might have some sleep disturbances, or they might feel a bit more anxious. That's typically usually what is going on there. And then also cortisol, which again is a little bit of a separate subject, but we have a cortisol rhythm, but in the stages where you have more elevated cortisol, which is actually perfectly natural, specifically in the morning, and that's basically cortisol is what wakes us up, has excitatory properties. Then on the inhibitory, which is what brings us more down, which can be beneficial in some instances.
When you say down, is it like we feel bad down, or is it like we're calm?
So it depends. So in excess, we feel like more, like literally down, more depressed. But in stable, in healthy levels, it can be beneficial. And I mean, these are actually some alternatives. Well, it's both how like certain like anxiolytics, which are anxiety medications, often work on these neurotransmitters, and there are you can actually give some of these amino acid precursors to get that kind of effect. So some people definitely want that effect. Our classic calming or inhibitory neurotransmitter is GABA, and that's basically why things like benzodiazepines are anxiolytic. Also, why having a few beers or a few cocktails makes us feel a little bit drowsy or more relaxed, is because it is having an impact on our GABA receptors. So back to the subject of hormones, progesterone has an inhibitory effects. It's actually, we even consider it a neurosteroid. And there is application of using high dose progesterone at night or one of its precursors. I mean, actually, that might be even an interesting talk at some point. I have like a really great diagram of like, where how hormones are produced and where they come from. So pregnenolone, which is our parent hormone, which produces both sides, both our estrogen and our progesterone, also can act as a neurosteroid. So making us feel more calm, more tired. It's also why often for women that are taking progesterone, either because they're having very, very heavy periods, or women who are trying to get pregnant and they have luteal phase defects, it's often prescribed at night because it does make them feel more drowsy and sometimes even make one feel dizzy. That's just something. And it's kind of, well, not kind of, but basically progesterone is very much responsible of why some women do feel a bit more blue, teary, depressed, lethargic, not a lot of energy in the 1 to 2 weeks leading up to menstruation.
And I think we can all connect with the cycles of our monthly cycles and how we feel. And we know some of us have extreme PMS symptoms where our mood may really tank. There are times during the month, like you said, where we're ramped up and our mood can be stable or our mood can feel kind of all over the place. So hormones, and specifically for women, our sex hormones are really powerful. And it's not just a joke like that. Our cycles can have an impact on our mood, whether we are diagnosed clinically with depression, anxiety, or another mood disorder, or whether we have dips, we have changes. What are some other, I guess we'll stick on like the hormone topic, that other hormones that can have an impact on our mental health?
Okay, so we covered obviously progesterone, estrogen. We talked a little bit about neurotransmitters. We talked about cortisol. Then the other specific, so thyroid very much so has an impact on mood. In fact, actually, I often both hypothyroid and then subclinical hypothyroid often is overlooked in cases of depression. So thyroid, we know it's a gland in our throat, and it produces 3 types of thyroid hormone. You have T4, which is semi-active, and we do produce some T3, which is our highly active thyroid hormone, but most of our T3 is produced outside the thyroid by the conversion of T4 to T3. And then in some cases, well, we always produce some what's called reverse T3. So basically reverse T3 is inactive, completely inactive thyroid hormone. And we produce it naturally, but we also produce it at higher rates during times of starvation. And guess what? When we diet, our body thinks we're starving, unfortunately. So, and it's basically a protective mechanism. So if either we're not producing enough thyroid hormone or we're not having enough conversion of the less active T4 to the more active T3, we're going to definitely have more depressed moods. Now, on the other side, is hyperthyroid, where basically our body is producing too much thyroid hormone. You're going to be having the opposite effect. And so you're going to maybe have insomnia, you're going to have heart palpitations, and other manifestations of overactive thyroid. And it's going to give you sort of anxious type feeling. In fact, actually, it's interesting. A few years ago, well, now I've been in practice so long, like now it's like, it used to be like a few years ago. It's like, oh, actually,
I know. Meanwhile, it was a decade ago.
Right. So I did work with a young woman who probably isn't even a young woman anymore. she was on thyroid hormone because of the fact that she had had Graves' disease. I wish she had seen me many, many years ago, unfortunately, because she ended up having thyroid ablation. So she had to basically be on thyroid hormone for the rest of her life. And it was interesting because at adequate dosage, so if anyone's watching this is who's already being treated for thyroid already knows this, that they continuously always have to adjust the dose. It's sort of like they have to kind of figure it out. And there's nothing wrong with that, but that's just how thyroid medication is dosed. And you test every like about 6 weeks usually initially, and then once things are more stable, less often. But even at normal dosages, like she just never got over the anxious feeling that she had felt when she initially had Graves. So even though like she was like her body was like functioning metabolically normal, she would interpret it herself as anxious or anxiety. So it's just sort of interesting how that works.
That is really interesting. Okay, so hormones play a huge role in our mood, and even further than that, can contribute to symptoms of what we would call anxiety or symptoms of what we would call depression. Now, before you get to the rest of this question, are antidepressants or anti-anxiety medications something that could help solve this problem for
So
these specific things?
well, I guess it depends on what do you mean by solve.
Well,
So
let's just say like let's say like resolve, like you're no longer suffering. It's not just a symptom management tool, but it actually helps resolve this problem.
yeah, I'm sorry, I'm have to ask you. So like,
Okay.
do you mean in general for mood disorders, or do you mean
Yeah.
specifically if a patient
For
has?
specifically people who might be struggling with a hormone imbalance or thyroid imbalance, whether it's underactive or overactive, and they are experiencing anxiety or depression because of it, would they benefit from taking a a long-term antidepressant or anti-anxiety medication with the effect that like this is going to help me feel better?
So okay, so this is like it's like kind of like so as far as actually self because it's interesting because like I always sometimes have to ask these questions to my patients because like there's the problem of why the patient seeks you out and then there's the real problem.
Mm.
So that's where I was like, I almost like felt like I had to like continuously ask you the same question. So as far as so someone who has hypothyroid uncontrolled might feel better on the SSRI for their depression, but they're not going to get a lot of long-term benefit. They might, it's like almost kind of like, yeah, if you're having a really bad day, and you have a couple of beers, you might feel like you're having a better day when maybe maybe you're still in debt or have like whatever all the problems that led you to drink the 6-pack of beer. Those problems still exist, and I think it's very similar. It's almost the same thing. Whenever I'm like working, for example, like with patients with headaches, yeah, you can take a headache medication, but you're not really treating the reason that you had the headache. So I guess it also just depends on one's goal. Similarly with the hormonal imbalance, the SSRI, sorry, antidepressant, isn't going to make the hormones balanced, but maybe some of like the psychological ramifications of the hormonal imbalance, they might not feel as much. But then again, like then you're going to also have a lot of the other side effects, specifically also when you think about the patient who has hypothyroid, one of the other side effects or symptoms of hypothyroid is weight gain. And guess what else also causes you to gain weight? Often antidepressants. So definitely could be making things worse. Also, another thing that can go hand in hand, hypothyroid can also lead to sexual dysfunction. Well, guess what else can? Antidepressants. Similarly, hormonal imbalances can lead to sexual dysfunction and weight gain, and so can SSRIs. So I think it's a little bit, I would say, missing those pieces is not going to really help the patient long term. I think that's a terrible, honestly, I would say that would be like a really terrible approach. Also, one of the problems too with any of these mood medication makes the assumption that it really always is the neurotransmitter as the cause, and that's
Yes,
not really true.
please talk more about that, because I think that's a
Right.
big myth or misunderstanding of what depression and anxiety is. Um, because, like, just to wrap up what you said before, that the it's like the question of, like you said, you can have a headache, but the reason you could have a headache is because you have a hangover from drinking too much wine. Maybe you hit your head. Maybe you have, chronic migraines. Those are three completely different
Right.
causes for headaches. You could take an Advil and it will get rid of the symptoms and you'll numb the pain and you're like, okay, I don't have a headache anymore. But if you don't ask why, what's causing this headache, and trace it back all the way upstream to the source or to the root cause, then you are missing a huge piece of the puzzle or many pieces of the puzzle, and you're missing an opportunity to rectify or heal the source of that issue from where it started. And so often, I think, as you're just about to get into, depression and anxiety are blamed on an imbalance in brain chemicals, but that is not always, and maybe not even usually, the case. But I would love to hear your perspective on this more.
Wow. It is so complex, specifically, even when we think about how mood disorders are even diagnosed, it's not as if you go to your psychiatrist and they do a blood test and they say, yeah, you're deficient it shows that you're low in serotonin, or if you're on more of the anxiety piece, oh, like it looks like your dopamine's high or whatever. Like that's not how this works. There's a thing, it's called the DSM, and basically based on frequency of your mood symptoms and any other accessory behaviors. Okay, we're going to diagnose you as such. And now we're going to start experimenting. Now, again, I will have to say that there's definitely a place for antidepressants, anxiolytics, patients who have bipolar, schizophrenia. There's definitely a time and place, but as far as when we think about how these things are diagnosed and how treatments are determined, it's almost like, I hate to say that it's not very scientific, but kind of isn't so scientific. And I have seen a lot of disasters come through my doors, unfortunately. People that have come through, having been on a lot of different antidepressants and anxiolytics and mixtures of different cocktails. And one of the harder things now too is that I feel like there's certain medications that have just become the new candy, and SSRIs are definitely among them. As of I would love to at some point do, oh my gosh, a whole discussion on digestion and how acid reflux medication, PPIs, also just a lot of primary care doctors are just writing that up for just any kind of symptom. So that is just something really to consider. I don't remember what the initial question was.
That's okay. But I think you were getting at such a good, you were really just opening it up to the fact that the way that depression and anxiety, mood disorders are diagnosed is kind of like, you go to a dictionary, AKA the DSM, and you go to the groupings of symptoms that the person's having, and they read, okay, well, this is diagnosed as generalized anxiety disorder or whatever. But there's no blood tests. There's, up until now, you don't even scan the brain. There are doctors who are doing SPECT scans of the brain, and they're able to see hyperactivity and underactivity and low blood flow, and it's getting a clearer picture of what's happening, and they can actually trace patterns of people with all sorts of brain brain health or brain issues that are commonly just seen as psychological issues, but there's actually a strong physiological component to it, but that's not the norm. And so there's a myth, like for so long I believed that the reason people have anxiety and depression was based off of commercials for antidepressants that I saw.
Mhm.
So the only reason I thought people had it was because you had a genetic um, chemical imbalance in your brain, and there was nothing you could do about it except take medication for it. And that was super scary to me as somebody who felt like I had these symptoms. Um, and it wasn't until years later that I started to study why. And now,
Mhm.
with functional medicine, I'm really understanding why, what the true, how many, like there are dozens of root causes for depression, for anxiety. And unfortunately, those symptoms are given, as an Advil for, just for comparison. They're just given a medication to reduce the symptoms. But number one, it's not necessarily addressing the
Mhm.
root cause. You're not even finding out what the root cause is. There's no further exploration to discover what that is. And then, which is even more frustrating, is when people don't have an improvement in their symptoms or don't have an improvement long term, and they are continually going from one drug to another, or like you said, a cocktail, and decades of in taking this can have an impact, and to not even see like a full result or a full recovery from it, I feel is really, really hard, like really frustrating. Like it angers me, to be quite honest. So the question, just to find a question inside of that, is just can you unveil a little bit more of this myth rather around root cause of anxiety and depression?
So again, yeah. So, um, and again, like there is always, I always like to say that there's always a time and place for medication, and and whenever because ultimately it's also about a quality of life thing, how long things are going to last, how much, the mood disturbance is impacting my patient, plus, how much resources, how much, because everything takes time. Because actually, even if you do go down the pharmaceutical route, most antidepressants, anxiolytics, are going to take about 8 weeks till you even have an effect. And I mean, and I've had this conversation many times with patients, because sometimes you also have to have like a realistic expectation that you might not feel better right away. And it can be a process both from the natural route and the pharmaceutical route. One of the things I think honestly, like in an ideal world, I'd say if you're having any kind of mood disturbance or issue, definitely at least trying the natural route first. I would also say too, if you do decide to do the natural route, doing it with a practitioner, and it doesn't have to be, I mean, whether it's a naturopath, functional doctor, but definitely exploring all the possibilities first, because there's so many other things that can even be going on. I mean, it doesn't necessarily have to be a hormonal imbalance, but like, I know that Christine talks a lot about like obviously diet and exercise and all these like other factors that could be going on that do play a big role in mental health. The other big factor too is what are some of the other things that are going on in the individual's life. I mean, one of the things that we have to also realize that we're not going to be happy all the time. That's just like reality, and things definitely happen. I feel like this year has been a real up and down roller coaster for everyone in on some level, and definitely more so for others. And that having the periodic ups and downs, highs and lows, is perfectly normal. It's perfectly normal to feel sad and depressed because of losing a loved one or losing work, being unemployed, like all these things. I mean, that's like perfectly part of the human experience. But it's when it goes beyond that or is coming out of blue, it's good to like look into other things. I mean, specifically again with women, really hormones are so important. And I have definitely also seen women on birth control, just by having them go off birth control, their mood disorder went away. Specifically, I see that very often in progesterone only forms of birth control, whether it's the hormonal IUD or the mini pill or some of the implants. Sometimes just getting that out of the system enough can dramatically improve moods.
Wow, that's incredible. What are some of the other physiological root causes that you have seen contributing to symptoms of anxiety and depression?
Oh, wow, a lot. So actually, Christine and I were chatting a little bit before, and I was saying to her, I was like, wow, the patient I had before this, I could just like talk about them. That would be like the whole talk and everything. One of the things that I think is often missed, specifically more in the conventional medical community, is histamine and mast cell activation. So mast cells we associate often with allergies, and they release histamine. So kind of back to the neurotransmitter piece. So histamines, besides obviously making our allergies go crazy and also causing things like acid reflux, and is one of the reasons why medications like Prilosec, which is an H2 blocker, basically blocking histamine, are so effective. But the histamine is also very excitatory, and that's one of the reasons why if off-label use of Benadryl is to help with sleep, because it reduces histamine levels. So something really to look into is giving the patient things that are going to help with reduce. So when we look at histamines, there's a couple of factors of either histamine excess, whether it's coming from the diet, or also looking at the breakdown of histamine. So we actually have an enzyme that actively breaks down histamine, but in some people it can be compromised either via that's a good one too. I got to talk about that one too. Either by genetic mutations or some deficiencies in the diet. So definitely that's like one factor when it comes specifically more towards the anxiety piece. And then looking at the depressive piece, another factor that, again, I don't know. I think that the mainstream medical community is getting a little bit more on board with is MTHFR mutation. What the heck is that? That is the enzyme that activates folate, and about 10% of the population actually does not activate folate, and that's something really to consider. It is actually now pretty much an easy test to get. Most conventional doctors will run it, and if we're having difficulty basically activating folate, this can have a big impact on fertility and pregnancy. It can have an impact on, actually can cause blood clots. It can have an effect on our ability to store and release iron. It has an impact on thyroid health. But methylation is really important when it comes to the production of neurotransmitters. So some patients who are on the depressive side, specifically if they have like a family history, if I also find out maybe they've had difficulty getting pregnant or there was a family history of that, often that's something to consider. Now, the weird thing or the unfortunate thing when it comes to MTHFR defects is that sometimes these patients have another defect, and that's on the COMT enzyme. And basically that enzyme breaks down specific neurotransmitters that are excitatory. So that's things like norepinephrine and epinephrine. So what happens sometimes is if you're giving this patient who has mutations in both, because you're like, oh, this is easy. they have an MTHFR mutation. I'm just going to give them some methylfolate and everything will be right with the world. And then what happens? That patient gets super anxious because basically their body is producing all this excitatory neurotransmitter that they're not breaking down efficiently. So you have to kind of, that's another thing to consider, like looking at both sides of that.
Is there a blood test for that second one that you mentioned?
Not as common. Typically, like, I mean, something really easy that, I mean, anybody watching this, you can easily get like a 23andMe. Actually, for both of those mutations, you can find out if you are, if you have those mutations. And there are things that you can do if you do have both, but it is just something else to consider. Also, the other thing too, and I did, when you're a green doctor, meaning a new doctor, sometimes you do make mistakes as well. I am always now so some specific antidepressants, specifically ones like Wellbutrin, that don't just increase serotonin levels, but also increase things like norepinephrine, epinephrine, dopamine. Even if that patient does have a mutation for MTHFR, often if you give them, even if they have an okay COMT, you are going to end up ramping up their norepinephrine and epinephrine, and they will feel more anxious. So you have to sort of be very cautious with methylated B vitamins in those patients as well.
So those are two examples of genes or genetic mutations that could contribute to mood disorder, but it's not in the way that we understand a genetic issue affecting brain chemicals. It's still a few steps removed from that, it sounds like.
Right. And then like other factors too. So again, like past trauma actually does change the brain. And, it's interesting how you're bringing up the brain scans. And like one of the things I'm a little bit nervous, I think it's really beneficial that they are starting to do that more. But I would really hate that starts driving more pharmaceutical specific therapies when there's so many other ways to improve regions of the brain, exercise, yoga, meditation, breath work, also things like different forms of psychotherapy, specifically cognitive behavioral therapy, DBT,
EMDR.
Yes, EMDR, biofeedback, neurofeedback. So it doesn't necessarily have to be a pharmaceutical route at all to improve these regions of the brain. And also, it's not pseudoscience either. There's so much really fantastic research, specifically when we think about some of the research that they've done on post-traumatic stress disorder, which basically, I don't want to say all the post-traumatic PTSD is, but basically PTSD is an overfiring or enlarging of the amygdala and underfiring, or also an atrophy of the prefrontal cortex. What are we even talking there? So prefrontal cortex is where we're able to make decisions, where we're able to properly store memories, versus our amygdala is kind of like, we sometimes consider it like a reptilian brain, where our some of like our flight,
the primal part. Yeah, exactly.
So we're just not going to be
flight.
Right. That's where, like, when somebody who has PTSD gets triggered, they just aren't able to think. Sometimes they completely can like blank out or zone out, or they get hyper vigilant out of nowhere, because you never know what's gonna trigger them.
You're in survival mode to the extreme effect.
Right.
And you're triggered there from, a post-traumatic reason. But isn't that the same pattern essentially that someone experiences when they have anxiety, whether it's they're just, they're experiencing a lower generalized anxiety to a full-on anxiety or panic attack?
I mean, partly. I wouldn't say 100%. But I mean, definitely, when we think about like somebody who is experiencing anxiety, they're not fully activating their prefrontal cortex. They're not going to be making the best rational decisions. I mean, that's kind of almost like when we think in like other cases of why, like, for example, like probably most people here, like the idea of like performing surgery or like doing something kind of or going to battle might be really difficult. But when your brain is activated differently and you're able to kind of witness these things that would typically you would lose focus, but you're so used to it at some point, you're able to basically focus and make quick decisions, effective decisions that someone else wouldn't be able to make under like that type of like pressure and stress and anxiety producing.
Yeah. And that's really where, would you say that's where the why stress is perceived? Like, it's stress, something that's stressful to one person is not going to be to another. And we as humans can essentially perceive stress just basically from our thoughts or thinking about the past or thinking about the future. And we can essentially trigger ourselves just by thought alone without an actual
100%.
present danger, in real life. And we can totally send ourselves into an anxiety attack or
Well, that's like I don't know if you're familiar with this concept like threshold of tolerance.
no.
But I mean, or another way just to kind of think about like is like comfort zone. And I know like you as a personal trainer, you're
Okay, yeah.
like improving people's endurance. Well, it's like kind of like the same idea of like mental endurance. And that's where like things again like mindfulness practices, things like meditation, they're not so much about like dealing with the anxiety in the moment, but basically helping us expand our level of tolerance. And basically anyone who is super anxious, or I mean, we live in New York City and we see people operating out of all kinds of crazy delusions on the street. Somebody who thinks that they're like a ghost or like something, like not operating the same plan. I mean, that's basically somebody who's really operating from this, anyone who's like, experiencing like paranoid delusions is operating from a very, very narrow threshold of tolerance, where someone else who is able to just kind of like things come and they just don't have like that same kind of like crazy reaction. And it's not necessarily that any of us are like born in this like super calm state. It's something we kind of have to work on. I mean, similarly, like as we work to improve our physical endurance or getting stronger, we really do have to kind of work on the mental health piece, whether again it's through mindfulness practices like meditation. But one of the things I love when I'm thinking about different therapies for my patients is something like cognitive behavioral therapy, where recognizing some of these automatic thought patterns, when you really investigate, aren't really based in reality. They might be based on some past trauma that we've experienced, but they're not really based in reality. Another form of psychotherapy that also can be really beneficial is narrative therapy, where we are really retaking some of these stories that we've created ourselves and unraveling, and that we can actually really rewrite our own story. I don't really, I will recommend these therapies to patients. I'm not a psychotherapist for anybody who is watching this and also who is appalled by my definitions of any of these forms of psychotherapy.
No, you're doing wonderful. Thank you for being so knowledgeable and sharing what you know and what this knowledge that we don't get to experience and hear on the everyday. I'm going to ask a question that Vicky asked, and she said, can a patient have their typical blood work done and have the results be normal or negative for any deficiencies, etc.? Everything's in working order, so to speak, on paper, but still potentially have something going on that could be a root cause for anxiety or depression symptoms that wasn't caught in the blood work.
Right. Well, I guess like there's a couple questions even more, because again, it's like interesting. These are things I get all the time, just like from like new new potential patients. So I'd say the first thing with the blood work, I mean, again, like this would be more my question specifically if this is like a potential new patient, is like what else, like there could be pieces missing. Meaning, for example, you could have a normal TSH, which is thyroid stimulating hormone, or also again, well, I guess, well, there's so many little factors here. So I would say one, it depends also like what kind of ranges this doctor is choosing to use and like what they're signifying as dysfunction and what's not.
Like you mentioned before, there's subclinical hypothyroid, which essentially takes a much narrower or much more expanded look at what could, like what the standard within that your blood work would be normal. It expands it and it says, well, actually, even if you're like a little bit outside the range that's considered normal, you're actually going to feel some stuff that's not going to feel so good. But that wouldn't necessarily be triggered as, blood work's off here.
Right. Because exactly. Because like, say for example, like if I have a patient who has a TSH of a 2.5, but they have like all the symptoms of hypothyroid. So typically, if you're just going to a regular Joe Schmo doctor and they're doing Joe Schmo labs, a TSH of 2.5 would not register as a reflex T4, T3. Well, probably definitely not a T3, but also probably not a T4. You probably have to hit like a 3 before they would do an automatic reflex T4. So what I would probably have that patient do is look, what is your T3 and T4? So, because I have seen patients with quote unquote normal TSH have low T3. And so again, like T3 being the active thyroid hormone. Also, honestly, most doctors are not going to out of the gate do like a very thorough blood work. It just isn't going to happen. One from a insurance standpoint, and also again like from and that also based on like diagnostic codes. So like I mean, it's very rare that like any just regular GP is going to do beyond just a CBC complete blood work. I'm sorry, complete blood count, chem panel. Maybe they might do a lipid panel. They aren't also going to automatically check iron or ferritin, specifically if your hematocrit is normal. So that's like the first thing. Honestly, most of the time, it's very rare that I have seen complete blood work or like sufficient blood work for what I'm looking at. So again, like for mood disorders, I would say, I mean, if you're really wanting to be thorough, your blood work, in addition to your CBC and your chem panel and your lipid panel, we definitely want to see vitamin D. I'm so surprised that that's not always standard. B12, folate, ideally, if they do test for MTHFR, that'd be fantastic. Not always. Definitely women, I would like to see a hormone panel. Some general practitioners feel like that's more the domain of either an endocrinologist or a gynecologist. So that's also another factor. There's a lot of politics along when it comes to medicine, and then also definitely an iron panel. And did I say lipid panel? So one of the things, thank you. So something also that I've seen in my practice, and the literature supports this, so LDL, which we often call bad cholesterol, actually having too low LDL is associated with depression and is also associated with increased suicide rates. So ideally, you really want your LDL to be about between 90 and 100. I really don't like seeing patients having LDL below 90 because it does have, and specifically also for women who are trying to get pregnant, cholesterol is actually really important. It's how we produce all our hormones. Yes, having too much cholesterol is also a problem, but for the most part, I've actually been seeing more and more women with too low cholesterol and that being problematic. Now, again, like so back to like Other things also to consider that might not be part of a standard panel, things to consider, different toxins, specifically heavy metals, can have a really big impact on moods. Other endocrine disrupting toxins, things like PCBs. Some of these things aren't really used so much anymore. A lot of things that we find in our plastics can have a big impact on hormones. Our microbiome. So basically, our microbiome are the different bacteria actually residing in all parts of our body, but specifically one area we're looking at is the GI tract, because we do consider our GI tract, our small intestine, as the second brain. And actually, the majority of our serotonin is actually produced in the gut. So that, of course, is obviously not going to be a standard test that most doctors are not going to be looking at. They're not going to be doing a stool analysis. They're not going to see if you have dysbiosis or SIBO, specifically if you're not necessarily having any GI symptoms. But I have seen patients that didn't necessarily have GI symptoms. Well, that's another thing, is some patients do have GI symptoms, but they don't even see them as symptoms. I have some patients that only have a bowel movement once a week. If you ask them if they're constipated, they would say no. And then I have some patients that go every day and they think they're constipated. So I think symptoms are sometimes on the side.
That's good to know, to ask those specific questions. That was fantastic. That was such a wealth of information, just answering that question about things to look out for, the depth of labs that are out there, and that are missed or just aren't ordered for whatever reason, and that there's a lot of ways to continue to dig if you have not arrived at the answer that you want to. I know I don't want to take too much more of your time, but since you did mention the gut, and the gut is so connected to the brain, I would just love to tap into that for a hot second. And that'll be our last topic tonight.
Yeah. And so there's so many factors that go into this. So, one of the things that we, obviously we're always talking about like probiotics and fermented foods and like, certain bacteria, specifically most of like, so the typical, strains of types of bacteria, we're thinking lactobacillus, bifido bacteria, and streptococcus types of bacteria that naturally are residing in the gut. And that's definitely a big factor, specifically the different strains of lactobacillus. Oh my gosh. It's been a long
You got
day.
it.
Are definitely really important when it comes to, because also it was interesting. It's sort of our gut talks to our brain and our brain talks to our gut. And there's also been like a lot of studies, even because one of the other big components to mood, and sometimes I really kind of classify both stress and anxiety really together, because stress is also playing a big part, because we even besides post-traumatic stress disorder, prolonged periods of stress cause, I'd say, like semi-permanent changes to the brain, because again, like a lot of these things with practice we can kind of undo whatever damage, but stress having a direct impact on the gut, and like what microbes are residing there. So in addition to both probiotics and incorporation of fermented foods, we also want to think about what are we supplying, what are we doing to support specifically GI diversity, and what are we doing to support the microbes. And so I know we all talk, everyone, I don't know, maybe I'm like making these assumptions about like your viewers, but I'm assuming that probably a lot of people have heard of like the Whole30 diet, and like, the Whole30 diet is kind of like a paleo diet.
I'm sure, yeah. I'm sure they have.
Well, another thing you want to think about what using that same number 30 is the concept of every week we want to be getting about 30 different types of plants in our diet. And the reason we want to do that is that's going to really help us have the most diverse microbiome. So the more diverse microbiome, besides helping with mental health, is going to be helping with metabolism. It's going to help with weight. It's going to help with blood sugar metabolism. It's going to help with so many oh my goodness, it's like endless.
Such a source. 30 different types of plants.
And so like this also includes like grains. It's not just fruits and vegetables, also like our nuts and seeds. Chocolate and coffee count, which is like really fantastic.
I love when you say that.
A lot of our herbs, so like turmeric and pepper and cinnamon, and they also are plants, but really trying to get a lot of diverse plants every single week is one of the best things we can do
to support gut
our
microbe diversity. Because when we have more gut microbe diversity, then just make that little connection.
Right. And also even, I forgot the other thing, immune health relies upon GI diversity, inflammation. And so again, like, yes, we talked a lot about like gut diversity helping with mood regulation directly, but also if gut diversity has a positive impact on inflammation also has an impact on mood. So it's like, why not?
There's so many sources.
Yeah.
What is it exactly about gut microbes that, like, what are they doing, and why having a diverse amount of them, like, how does that even connect to our brain health? Do you know what I mean? Like, can we just close that connection?
Sure, absolutely. So besides, having a direct, the ability to produce neurotransmitters, they honestly, like I always like to say, like human beings are like the weakest species on the planet, and we really need a lot of species helping us out. If it wasn't for our gut microbiome, so many nutrients, like not just like that are really important for mood health, things like zinc and magnesium, even our omega-3 fatty acids, we really depend on those microbiome, the species in our microbiome to help us break down and assimilate these nutrients, and also just protect and making sure things are working. I mean, our gut is so important. Like I feel like, oh my gosh, like if one thing you do, like making your life mission, like protect your gut, like just really like love your gut, and everything will follow.
I love that as a final comment. Life mission: protect your gut at all costs.
100%, 100%. So I
That's
like
awesome.
even like it's like I'm like, so I have like supplements all over my place, and like I even have like a couple like gut supportive supplements like right next to me. I'm not going to show them, but it's just like hilarious. I'm like, oh, right there. Yeah.
Well, thank you so much. As always, this is packed with so much information, and I wish we could do another hour because I love this topic, obviously. And there's just so much more. But thank you for going deeper with us. I don't think we just scratched the surface today. We gave everyone definitely at least like a replay. Even if you watched it through the first time, it's like, I'm going to go back and watch that again to catch the things that I missed. Well, thank you so much for your time. And thank you, everyone. Just so you know, like some comments in the chat are just so good. Thank you. I'm definitely going to watch the replay. Great questions. This has been very informative. So we're getting lots of love. Dr. Ivy. And if you have any specific questions about your own personal health, you can reach out to Dr. Ivy. If you didn't see her email, I can send it to you and you can reach out to her directly. And she does work with people virtually, and she's been doing this forever. And she's literally, I think, at like the top of like the game when it comes to approaching your body from the most natural and from the most like address the root cause, find the root cause that that you can, so you can actually start to feel your best and thrive. And on that note, thanks, guys. Have a great night.
Yeah, thank you. I can't wait to do it again.
Yes, next month we'll be doing this again on another topic. And I'm going to poll you guys for what topics you want to hear. We have a list, so I'll poll you and then I'll announce the topic at the beginning of June. And we'll officially have the date for that as well.
Fantastic. Okay.
Thank you.
Good night.
Bye. Have a great night.
Bye.